surgical options for belly fat removal, of course, is surgery. That is depending on the age of the patient and parity of the client. If the belly fat amount is not excessive and there is hardly a droop, liposuction is a good option. This will work for a very active woman who has a daily or weekly routine of her physical activities. Liposuction under general anesthesia would do very well. But if the client has had children and maybe a cesarean section and so on, and there is a droop in the abdomen, of course liposuction might not be enough. Then we have to do surgery, and that procedure is called an abdominoplasty. Procedure is a broad topic. Of course, in short, I would say that it entails removal of the excessive fat containing skin, rearrangement of the recti, that the recti are the rectus abdominis muscles which holds the entire anterior abdominal wall in the center. So we have to rearrange that, and also reposition the umbilicus, that is the tummy button. And to achieve all this, the client needs an incision which takes away all these skin with fat, and we will end up with a very low scar just above the pubic hairline, going on the sides in a way that it won't be seen, and the tummy button is repositioned very well. Therefore, the whole abdomen gets a good rearrangement with the strength of the two muscles that I mentioned. The rectus abdominis muscles are brought to the center and given the anterior strength that is required for a flat tummy. The liposuction and tummy tuck both can happen in the same client. Of course, the liposuction is a very good tool to liposculpt the future abdomen, that is to achieve the central groove, the lateral hollows, to liposculpt the abdomen to give a final best result. Liposuction means sucking away the abdominal fat which is between the deep muscles and under the skin. So those two levels contain the fat. So the fat is sucked out as a liquid. We put in something called a tumescent solution which holds the fat in its liquid environment and then which is sucked. So the suction can vary. This is also done under general anesthesia. Suction, the sucked out fat comes into bottles like liquid fat. So that's liposuction. The amount will vary, might be 3 liters, 2 liters or 1 liter or half a liter, but there is a limit. So the more you try to overdo this, the more are the complications. That's a different topic altogether. But within the safe limits, rest assured, I have done so many, so I haven't had a problem. So we do that. The abdominoplasty is what I just described. It's an operation. Now for liposuction, we don't need a big cut. There are small stab wounds, maybe 4 millimeters, 3 millimeters, maybe several of them very low, and those heal very well and never to be seen again. If you are a person who is above 80 kilos, if you go by the weight, for a standard Sri Lankan woman who is, shall we say, the average height is about 5'6", the maximum body weight should be about 65 kilos. 60 kilos is very good. But if you are touching 80 and 90, I wouldn't operate first. Such a client is referred first for weight control. Weight control is better advised by qualified nutritionists who are available in most of the hospitals, and we have the standard referral system. And then I would see the client again once the desired weight range is achieved. If those things are right, the client is ready to have the operation. Liposuction, of course, can be done for a 80 kilo person, but still this shouldn't be a one-off procedure. You want to look good. Therefore, it's a lifestyle changing procedure, whichever way you take it, liposuction or operation or liposuction with operation. Therefore, shouldn't be a one-off procedure and should be taken seriously. Now, pregnancy is a procedure that to normalize it takes a while. So not immediately after pregnancy, not before pregnancy. Now, if the family is not complete, if the client is expecting to have another pregnancy, these operation, you can have a liposuction. Operation should be deferred, and I would strongly advise the operation to be done once the family is complete. That is, if the client is young and the first pregnancy, obviously there will be a second pregnancy. Therefore, we should wait for that time, because the operation and pregnancies are two opposing procedures. One is trying to stretch and undo. My procedure is try to tighten and make the tummy small. Therefore, we shouldn't have a conflict here. Therefore, I would wait until the pregnancies are complete and the client is ready. Abdominoplasty, the client has a cut and a dressing. And a dressing is there on the lower cut, that is just above the pubic hair and round the belly button. And that client wears what is called a binder. So abdomen is tight, so the client finds it difficult to walk initially, but within about 6 days, 5 days, perfectly normal walking. And of course, rest in the sense that if you are working, don't go to work for about a week, and working out will take a little longer, and gradually build up yourself to come out of the house. So within about a month you are a normal person in an abdominoplasty. But liposuction, much earlier than that, within about 2 weeks you are back to normal. Liposuction very often can be for males, and I have done so many males. Of course, if such a person is trying to look good and maintain weight and to go to a workout gym, all that, it's a great procedure for a man. That is liposuction, and few men have come for abdominoplasty as well, and these men are distressed with a hanging lower abdomen, which interferes with their daily activities. That category needs abdominoplasty. And also in men, those who have lost a lot of weight also have a problem of hanging abdomen, so they need abdominoplasty. So that operation too is something like which I described for men. So it's not uncommon in men, so it's done, both procedures, abdominoplasty and liposuction. These procedures, liposuction and abdominoplasty in the same sitting, shouldn't be a one-off procedure. If somebody is, health conscious, where the individual wants to maintain the healthy weight range, the procedure is a permanent thing. Liposuction is a permanent procedure. The sucked fat cells are lost for good, permanently lost, and you achieve shape which could be permanent if your weight remains the same throughout. But if you are a person who goes again and then increase the weight, then what happens is the remaining fat cells will enlarge. Fat cells won't multiply, but the remaining fat cells now will have more room to expand. So they can, the fat cell which is 1 centimeter, shall we say, will be about 10 centimeters in size. So there is such a lot of room to expand. So don't make them, they are permanent procedures, but to remain permanent, one has to follow the dietetic and healthy guidelines for a lifestyle change. Risks involved are the immediate and late risks. Also, if you go on the net and read about abdominoplasty, there's so much in the list, too long to mention. So if you say a reasonable risk in an operation, immediately you can run into problems like blood accumulation, hematoma accumulation, a seroma which will need probably aspirations and going into the theatre again. Small areas of the skin can be lost early. Small areas of the tummy button can be lost early. Of course, the bruising and hardness that you would see should disappear in time to come. Of course, the dreaded complication that we all plastic surgeons try to avoid is deep vein thrombosis. So beforehand, we eliminate certain people who are mostly prone to deep vein thrombosis. a previous history of DVT itself. You have to give sufficient time for such a client to recover from DVT. You have varicose veins, that category can run into deep vein thrombosis. It's the entity where the deep veins will accumulate blood, which then clot, and this is then taken to your lungs. It's a serious complication which can happen in any operation, but for cosmetic procedures it shouldn't happen. So there are ways of avoiding such a thing happening. In the history, in the first consultation, second consultation, we spot them and correct them. Most of them are correctable, and then after surgery the client is given a pair of stockings to wear. They are called TED stockings, thromboembolic deterrent stockings, TED stockings. They are available in the hospital. So this is worn before surgery, and the client walks away from the hospital after surgery with the stockings. These stockings are worn for the next 7 days. In some instances there are calf pumps that we use in the theatre, then in the entire recovery period on top of the TED stockings. If there is a risk that we see that might interfere in the venous thrombosis, that is venous clotting, we apply the automatic calf pumps which are applied during the whole procedure. The procedure, if you say abdominoplasty, takes about 3 hours, 3.5, can be 4 hours also. So entire 4 hours, such a client, the calves have these automatic pumps. It's like you walking, and the pump alternatively, the system relaxes and inflates air, so the venous blood is pumped back into the heart and into the circulation. So there is no stasis. Then such a client goes home with the TED stockings, or sometimes even we let them go with the pumps. And at home there are portable small pumps. At home 3-4 days, client comes back to the clinic, we disconnect, and then TED stockings for another week. That's done. So this is the next complication that I would always try to avoid, in both categories, both liposuction and in the operation. And we have avoided such a thing happening. But if you read the literature, the post-operative complications, you will definitely read this point.